हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के सम इम्पोर्टेंट एमसीक्यू। द असेसमेंट ऑफ ब्लड कंपोनेंट स्कोर एबीसी score during massive blood transfusion include all of the following except HR, RR, SVP and penetrating injury. Here the RR is not assessed in ABC score, not assessed in ABC score. Assessment of blood component स्कोर और ABC स्कोर, इसमें क्या क्या होता है? कंपोनेंट पॉइंट, पेनिट्रेटिंग इंजरी को 1 पॉइंट, फास्ट पॉजिटिव 1, HR more than 100 per minute 1 point, and SBP 90 mmHg 1 point. This one is the point and component. Next question. A 50-year-old male patient complained of a fever of 38 degrees centigrade for the past 1 month. She denied any type of food infection or pets at home. She is known case of diabetes and hypertension. Investigation showed increased CPR with other normal values. The doctor finds no potential diagnostic clues for fever. What should be the next best management? FDG PET, exclude manipulation with thermometer. This one is the best answer because here this is the classic case of what? Pyrexia of which fever? Unknown fever. Unknown fever. Here the question denies of any level of or food infection and a history of fever for the past month with no potential diagnostic clues, which helps in pointing out what? Pyrexia or unknown fever. Next question. A 12-year-old child present to the pediatric clinic with a complaint of hearing difficulties and frequent bone pain. Upon examination, the child is found to be bilateral sensorineural deafness and signs suggest to have calcium wasting, including nephrocalcinosis and renal rickets. Which medication is most likely to prescribe for the treatment of this condition? Furosemide, hydrochlorothiazide, spironolactone, and indomethacin. Indomethacin is the best answer because here the Bartter syndrome is a क्या होता है? Bartter syndrome जो होता है rare genetic disorder characterized by electrolyte imbalance including renal salt wasting leading to hypokalemia, metabolic alkalosis, and hypercalciuria. Indomethacin क्या है? नॉन स्टेरॉइडल एंटी इंफ्लेमेटरी ड्रग्स है and it's is commonly used in the treatment of Bartter syndrome due to ability to inhibit prostaglandin synthesis, thereby reduce renal salt wasting and help to correct the electrolyte balance. और ये also helps करता है reducing urinary calcium excretion में, which can prevent nephrocalcinosis and renal rickets. Next question. Which of the following is a left-finding prerenal AKI? FENA more than 1%, urine osmolality more than 500 ml per liter, MO/mol. Best answer. Urinary osmolality more than 500 mO/mol is a finding of prerenal AKI. And other finding urinary sodium high and tubercular damage and Na more than 1% is the lab finding of renal AKI. Here we give one table pre-renal AKI and renal AKI. Pre-renal example cholera, then dehydration, body tries to reabsorb sodium and water so as to compensate for reduced perfusion. Then urinary sodium low, and one more than 1% urine osmolality more than 500 mmol. Pre-AK, this one our question. And renal में example tubercular damage, then salt wasting, water loss, then dilute urine, and then urinary sodium high Fe, and more than 1%, and यहाँ पे यूरिन ऑस्मोलिटी 300 होता है और यहाँ पे 500, मोर देन यहाँ पे लेस देन. This one is the MCQ. And next question, which of the following statement incorrectly describe a border of Passaro triangle? Superiorly by the confluence of cystic and common bile duct, medially by the junction of the first and second part of the duodenum. This one is the best answer. The medially by the junction of the first and second parts of the duodenum is here wrong answer, because the Passaro triangle are bounded by the junction of what? Secondary and third part of the duodenum inferiorly. A Passaro triangle is formed by joining the 3 points. वो 3 points क्या क्या है? First, confluence of cystic and common bile duct. कहाँ? Superiorly. क्या है? Confluence of cystic and common bile duct superiorly. And second, junction of neck and body of pancreas, and body of pancreas क्या? Medially. Body of pancreas medially. Third junction of second and third of duodenum inferiorly. कहाँ पे होता है? Inferiorly होता है. This one is the Passaro triangle of gastrinoma. This one is the Passaro angle of gastrinoma. This one is the Passaro triangle of gastrinoma. So 3 point क्या क्या है Passaro triangle के? First, confluence of cystic and common bile duct superiorly, and junction of neck and body of pancreas medially, and junction of the second and third part of duodenum inferiorly. This one is the important question. So today that's all. Thank you and keep revising.